I want to especially thank the members of the committee that have stuck it out this far with all of us. Mr. Chairman, just before I get started with my prepared remarks, I just wanted to remark on the fact that the way 114711 is written says that permit holders shall be able to carry their firearms everywhere within the state. So the way that law is actually written, that would include the Capitol building, the courts, the other buildings that I've learned tonight around the state that have metal detectors and prevent people with firearms from entering. I've actually written some letters to the Attorney General and to the Chief of Police of both the Capitol Police and the Providence Police on this issue. And I would love to know if there's some sort of either law or other basis for these regulations that I'm not seeing. That's especially because we talked a lot about being safe here at the Capitol building. Sure, within the building we're probably safe with the officers stationed around. But I have to walk back to my car tonight now at probably going to be 2 o'clock in the morning. And I'm going to be walking around with an empty holster because I have to leave my gun in my car. And that's not safe. So, with that, my name is Evan Stern. I'm a medical student at Brown University. Because it came up, I'm going to be clear that I'm not speaking on behalf of the university. I'm speaking on behalf of myself. I'm here today to offer my professional medical opinion on the bills before the committee this evening. In general terms, I support the legislation before the committee, which is pro-Second Amendment, and oppose the legislation which seeks to violate the constitutionally protected natural, civil, and human rights to keep and bear arms enjoyed by all Rhode Islanders. Why is a medical student testifying here tonight? Well, I draw inspiration from the Hippocratic Oath, first do no harm. I see no reason why that ancient piece of wisdom shouldn't apply to legislators as well as doctors. When a patient has a complaint, like Rhode Island does tonight, it is the duty of that physician to first do no harm, and second, to do everything in his or her power to make the patient well again. Tonight, I diagnosed Rhode Island with a chronic case of gun control, with an acute flare-up which may cause permanent damage without immediate action. Members of the committee, how shall we treat our patient? First, we must do no harm. Gun control, like most infectious diseases, most severely affects the most vulnerable of society: the poor, minorities, women, the elderly, and the infirm. To first do no harm, we must first not pass H 5067, 5154, 5155, 5262, 5263, 5345, 5437, 5510, 5547, 5554, 5608, 5730, or 5866. Each of these bills would be harmful to the people of Rhode Island. For the sake of brevity, I will not go into specifics of why I oppose or support the legislation before you, but I will submit a copy of my written remarks which have extensive footnotes expressing my opinions on each of the bills. The poor often cannot afford the burdensome costs associated with legally carrying a firearm, especially here in the Ocean State. Providence, for example, illegally charges $250 for a concealed carry permit, in addition to the incidental costs such as photographs, fingerprinting, and notarization. At $9.60 an hour, a minimum wage worker would need to labor over 26 hours before taxes to be able to pay for a permission slip to exercise their natural human right to self-defense. About 50 years ago, we eliminated poll taxes with respect to voting rights because of their discriminatory nature against minorities and the poor, and we ought to do the same with respect to our other constitutionally protected natural, civil, and human rights. Furthermore, the $250 fee does not account for the cost to actually purchase a firearm, ammunition, holster, safe storage equipment, or training, or to take the required shooting proficiency test. Nor does that figure account for lost time at work or with family to undergo an interview, get identification documents and reference letters notarized, and so on. Toss in the extra legal onerous requirements such as psychology tests that some towns that resist civil rights require. It is little wonder why so few of Rhode Island's poorest residents have permits. The poorest tend to live in the highest crime neighborhoods and are therefore at the greatest need to exercise their constitutionally protected natural, civil, and human right to bear arms. It is a matter of public health that they be able to do so. Many of my friends at Brown speak of structural racism, a concept based in part on the idea that laws which are not explicitly racist are still racist if they have the practical effect of burdening one ethnic group more than others. Anyone on the committee or listening tonight in the audience or at home must recognize that gun control is structurally racist. Rhode Island's poorest are also largely black and Hispanic, and they bear the largest burden when it comes to obtaining carry permits. They also tend to live in the highest crime neighborhoods and so therefore have the greatest need for access to their human right to bear arms. Do Black Lives Matter? As a medical professional, I know that they do. Furthermore, the history of gun control in this country is explicitly racist. Early slave codes prevented African Americans from keeping or bearing arms. Jim Crow-era laws perpetuated that notion. In 1941, a Florida court ruled in Watson v. Stone that a permit requirement to bear arms was, quote, passed for the purposes of disarming the Negro laborers. Even Martin Luther King Jr. was denied a May issue Alabama carry permit in 1956. As a medical professional, I cannot support gun control because I believe it is antithetical to the principle of treating people based on the content of their character rather than the color of their skin. Moreover, gun control is sexist. It is a biological fact that on average men are larger and more muscular than women. Therefore, making it difficult for the average citizen to get a carry permit disadvantages and burdens women more than men. For an example, a 5'2", 100-pound woman with a gun could fight off an ex-linebacker male assailant, but without one she is likely to be just another statistic. The principle, of course, holds if the sexes of the victim and the assailant are reversed, but because of biology, women bear the greater burden. Therefore, as a medical professional, I cannot support any legislation which would make it more difficult for all people to bear arms. By the same logic, the elderly and the infirm are less able to defend themselves against unprovoked assault than younger and more healthy individuals. Those in a wheelchair, for example, cannot be expected to fight back against an assailant with as much efficacy, I should add. As a future physician, I am obligated to advocate for their ability to legally exercise their constitutionally protected natural, civil, and human right to bear arms. Second, after we have done no harm, physicians are obligated to take steps to make their patients well again. You have the opportunity tonight to do that by advancing H 5115, 5081, 5156, 5248, 5546, 5729, 6039, and 6040. By passing these bills and making Rhode Island more pro-Second Amendment, you will be vaccinating Rhode Island against many forms of crime. Not the only way to stop a bad guy with a gun, but simply the most effective and best way to stop a bad guy with a gun is with a good guy with a gun. By passing the bill standardizing concealed carry applications, you fight the racist and classist nature of RIGL 114711 as it is currently practiced today, along with the way 114718 is implemented. By recognizing that stun guns are protected by the Second Amendment, you alleviate the burden that many who are not comfortable carrying firearms bear. I know many people are uncomfortable with the idea of carrying a lethal weapon, but who would carry a stun gun. It is my considered and professional medical opinion that having a stun gun for self-defense would lead to better victim outcomes than victims not having any other means of self-defense. By exempting safe storage materials from gun sales tax, for guns from sales tax, you may help to continue the downward trend of accidental firearms fatalities in this country by reducing the financial barriers to purchasing gun safes and other safe storage materials in Rhode Island. By forming reciprocity agreements with other states, Rhode Islanders will be less burdened while they travel. They will less often have to choose between their rights and personal safety on one hand and following the law on the other. Plus, with more law-abiding visitors carrying Rhode Island, you would make Rhode Island a safer place. I expect to see fewer murder, rape, and assault victims in our emergency departments, with more citizens legally bearing arms, which would also mean a reduction in crime. Therefore, as your consulting medical professional tonight, I recommend that you prescribe a healthy dose of civil rights. Do it for personal freedom and liberty. Do it to fight classism, racism, and sexism. Do it in the name of public health and safety. Do it for any reason you wish, but it's important that you pass the pro-Second Amendment bills tonight and stop the gun control and confiscation bills. Thank you.